And to be honest, multi-stakeholder engagement is at its infancy. We don't have shared outcomes yet for research. We've developed a few tools, the Delphi, and we have the face survey we use. We've done, but I believe it's very early times. But I think that the most exciting thing is this idea of durable relationships. So I once bought Adidas for my son, and maybe a pair for me too, but it was really for my son at the first part. And since then, they've been cultivating a relationship with me as a buyer, but it's really, I'm a stakeholder, and they've been sending me interesting information about different things, and I can't sometimes resist to seeing how they're doing this. So what they want me to do is to buy another pair in the future. Has anyone done this in medicine yet? I don't believe we've actually really cultivated a long-term relationship with their stakeholders. So this is the future. This is the 2.0. It could be expensive. It could be, how do you do it? So I think this is what we need, because that's health literacy. So health literacy is not the one-time interaction.
We invited 10,000 patients of ours to meet with us on a Saturday in February. We sent out emails, 10,000 people, but we actually also put posters in our waiting rooms. And we were blown away that 350 people agreed to come. So that was more than we needed. So we randomly selected 36 of those 350, and we randomly selected them so that they were diverse and they represented our practices: age, self-reported age, gender, housing, and also self-reported health. So we asked people questions about that, and we ensured that the panel that we brought together actually was diverse from that perspective. I think one of the most favorite experiences for the patients attending was actually getting to be a healthcare insider for like a couple of hours, where we educated people about, this is the way, these are the kinds of things that we need to report to government, this is how we're structured, this is who our team is made up of. We had a little Q&A with our staff, like the doctors and nurses and others who worked in our team, so that they could understand kind of what the workflow was like. And that meant that, in the end of the day, when they were giving us our recommendations, they were really thoughtful, practical recommendations, things that we could implement. I think it's really important, if you undertake the journey to work with patients, that at the end of the day, you're committed to delivering on it too.